Talk to me about clinical indications that you use these orthobiologic regenerative medicine products for within the hips. What kind of outcomes are expected? And when you say, you know what, you need to go to surgery.
So the hip is obviously a complex structure as well. It's similar to the shoulder, and that's a ball and socket joint, and has 360-degree movement potential, but it also carries the weight of your body, your upper half of your body, which can lead to a tremendous amount of stress and degeneration over time. For the hip specifically, I treat a lot of hip arthritis, a lot of hip labral tears, and then also insertional tendinopathies, similar to the shoulder, but with the glutes, the piriformis muscles, those structures that kind of attach to your greater trochanter and help your hip open, close, rotate appropriately. Something we see not a lot of, but frequently, is also a condition called avascular necrosis, which is there's limited blood supply to the hip, and patients often come asking, should I get stem cells for this? It's a tough question. For avascular necrosis, I think they have to see a surgeon first to make that determination, because we don't want to set false expectations that the stem cells are going to prevent that, and the disease progresses even further over time, and now they're needing an emergent hip replacement. The patient experience, hip injections can be tough. There's a lot of vasculature and the nerves running in that area. So we have to be very precise in how we do these injections. Again, everything for the hip is under ultrasound or fluoroscopy guidance. So very precise, very accurate of where we're putting the needle, where we're putting the product. Similar to other body parts, the injection time maybe is relatively quick, about 10 minutes to do the procedure. And then the expectations for hip recovery, it's, we have to get you into good physical therapy, give it at least a couple of weeks to see how you progress, and hopefully have incremental progress as time goes by.